Hello, everybody, and after Bismillah ar-Rahman ar-Rahim, hello to everyone, and welcome to all my friends and my colleagues and my fans. And today I want to speak about a very important issue in clinical practice and in clinical, to be more specific, in clinical hematology, and this is what we call the blood rheology or the hemorheology. The blood rheology is, by definition, is the scientific field discussing the what we call the biophysical properties and the flow properties of blood as a fluid. And we should know that the most common and the most important, well-known blood rheology or hemorrheology factor is is viscosity or blood viscosity. And the plasma viscosity is part of the blood viscosity, but the whole blood viscosity is more predominant. And the whole blood viscosity is the most important factor, and the plasma viscosity is part of the blood viscosity. But since it is the whole blood which is flowing inside the blood vessels and inside the human body as the most important fluid, and it is the fluid of life, blood, the most important for us is to talk about the viscosity of the whole blood. And in order to understand what is the viscosity of the whole blood, we have to understand that and to stress on the fact that blood is not a simple fluid. The blood is not a simple fluid like water, and it's not a simple liquid. It is a two-phase liquid, in fact. It's formed of an aqueous solution which is the plasma, in which there is a group of molecules, proteins, and salts, and this is the plasma. It is an aqueous solution in which there are molecules, proteins, and salts. In addition to the cellular components of the blood, which are the erythrocytes, the thrombocytes or the platelets, and the leukocytes or the white blood cells. These cellular elements and the plasma together, they are determinants of the whole blood viscosity or the whole blood physical or biophysical characters. To go back again to the issue of rheology and what affects the rheology, we have to understand that, as I mentioned, the blood is a not simple fluid. It is a two-component liquid formed of cellular elements and plasma, which is an aqueous solution in which there are molecules and proteins and salts, as I mentioned. And it is very important to understand that the whole blood is not what we call Newtonian fluid or Newtonian liquid. That is the blood viscosity is affected by what we call the shear rate, and the blood becomes less viscous at high shear rates, معدلات احتكاك عالية or معدل قص عالي داخل البلاد vessels, inside the blood vessels. So the blood viscosity is inversely related with what we call the shear rate inside the blood vessels or the circulation, whether the microcirculation or the macro circulation, and the blood becomes less viscous at high shear rates as in conditions associated or happening during, for example, exercise or during systole and high cardiac output rates. That here the flow of blood is more fast and is more rapid, so the blood becomes less viscous, and this will push us to know the fact that the viscosity of the blood is affected by the stress put on it. Again, the viscosity of blood is affected by the stress put on it, that's put on the blood, and that's to say that it is affected by the shear rate, as I mentioned, and the blood becomes less viscous with high shear rates, as it happens when during conditions like exercise or during systole and high cardiac output states. And it is very important to understand that according to Boisier law, and this is a very important physical law put forward by Boisiel in the 19th century, as far as I remember, in the year 1883. Boisiel said that the fluid flow velocity depends on the pressure inside the tube. That's here in the human body, the pressure inside the blood vessel, which is same as a tube, and the resistance met with. And the resistance to the flow depends on the geometry of the tube. The tube here is the blood vessel, for example, artery or vein. And the geometry of the tube, this means that the diameter and the length of the tube. What is the length of the blood vessel and what is the diameter of the blood vessel in our case here? Because the tube in our case is a blood vessel. So the resistance depends on the geometry of the tube, geometry of the blood vessel, that is the length and the diameter of the blood vessel in which this fluid, which is blood, is passing. And this will affect the flow characteristics or the biophysical characteristics of this fluid flowing, which is blood flowing inside this tube, which is the blood vessel. So the resistance to flow depends on the length and the diameter of the blood vessel and the fluid viscosity. So the fluid viscosity and the geometry of the tube determine the resistance, and the resistance and the pressure will determine the velocity of flow, or the fluid flow velocity. So the fluid flow velocity depends on pressure and resistance depends on geometry of the tube and the viscosity of the fluid. These are all determinants of how this fluid will flow inside the blood vessel, and this is basic to understand why viscosity, that is increased blood viscosity, is associated with what we call increased vascular resistance. But in healthy conditions, the blood viscosity is a moderator of what we call the nitric oxide secretion by the endothelium of the blood vessel, because it enhances the nitric oxide synthase enzyme, so it produces it. So when there is very high flow rates and very high viscosity, the blood viscosity increases, there will be vasodilatation. But in pathological conditions, the situation is different. For example, if we come to a condition like sickle cell disease or sickle cell anemia, in which there is a problem in the RBC deformability, so we find that the vascular resistance, there is vascular changes which prevents vasodilatation, and there is a propensity to what we call vaso-occlusive crises. Vaso-occlusive crisis is due to obstruction of the small blood vessels by this hyperviscous blood, because there is sickle cell disease is one of the causes of hyperviscosity, as I will mention. Let me go back again and to repeat the issue of Newtonian fluid and non-Newtonian fluid. Plasma is like water, it is Newtonian. That is, Newtonian fluid means that it resists deformation and the blood viscosity is the same. It's not affected by any stress put on the fluid. But non-Newtonian means, and this is the behavior of the whole blood. The whole blood is non-Newtonian fluid, and it follows the non-Newtonian rheology rules, which are the deformation rate dependency, deformation rate dependency, that is the deformation of the blood cell, and the most important here is the erythrocyte. So erythrocyte deformation dependency, what we call viscoelasticity, that's elasticity of the viscosity of the blood, and thixotropy, and the yield stress. These are the rules of what we call the non-Newtonian rheology. The whole blood follows this, because the whole blood is affected by deformability rate, by viscosity, by yield stress, by all this, by this stress put on the blood under different conditions. So the viscosity changes with changing conditions of the flow of blood inside the blood vessels. It is not a simple fluid. The whole blood is not a simple fluid, is not a Newtonian fluid following the Newtonian rules, but it is a non-Newtonian fluid with non-Newtonian rheology characters.